About 300 to 400,000 women die each year in Africa as a result of labour-related complications. Those who survive are sometimes left with a devastating, shameful injury called fistula. A hole or fistula develops between the bladder and birth canal after a long labour of 3 to 7 days. Women with fistula will leak urine or faeces for the rest of their lives unless they are treated surgically. Like many other developing countries in Africa, Ethiopia struggles to keep up with the demand of quality healthcare. Women in many rural areas are forced to deliver at home. Due to the lack of accessible healthcare facilities, most women never reach the hospital in time for birth. Deliveries unattended by skilled healthcare professionals increase the risk of developing complications and obstructed labour. The way to prevent fistula is to ensure that all women can gain access to medical care during their births.
So I lived in Barhirdar for 5 years. My wife and I and young child moved up there. Our baby was about 6 months old. We moved there to start a fistula hospital. There was a real need to start preventing fistulas because every day when you go to work, more fistula patients come with devastating stories, devastating injuries, lives ruined. Renovated an old office, which is literally a tin shed, and developed that into a maternity unit. The next stage is to build a bigger maternity unit to increase our capacity for women. The new 20-bed hospital will be able to deliver 2,500 to 3,000 women a year.
Maternity Africa aims to reduce the number of fistula cases by upgrading government hospitals, building and running maternity hospitals, training midwives, nurses and doctors on how to deliver women safely.
So the aim of the hospital in Barhirdar is to, one, provide the service, to take a workload off the government hospital, and to train midwives, support midwives around the health centres, and also to train higher grade health professionals.
We aim to provide free maternal health service to the poorest of the poor, to provide a facility that no one is kept away from. Everyone feels the freedom to access it for safe delivery. It's a comprehensive team approach built on an evidence-based foundation which provides the midwives and the mums with just a wonderful environment for safe delivery.
The Barhirdar Health Centre provides free maternal health care to women in the region. Midwives are trained to treat almost every complication up to a caesarean section.
Our health center is giving comprehensive health service. That means not only just giving birth vaginally, but sometimes we use vacuums, forceps. Even if there's an indication of caesarean sections, we have settings, operation settings. We just do these caesarean sections. All deliveries, all pregnancies are supervised and appropriate care is provided by the midwives. So by doing this, we just reduce the maternal mortality and morbidity.
The primary focus of maternal care in Barhirdar is to provide safe obstetric care to all women in the area. Midwives ensure the safe delivery of over 2,000 babies each year.
When we talk about midwife training program in Barhirdar, it's actually a great example of our commitment to clinical on-the-job training. It's a showcasing of clinical competence, clinical skills, mentoring, support, continuing medical education.
A large impact can be made to the number of women and children dying in childbirth just by providing simple measures.
Kangaroo care is the same as skin-to-skin contact, putting the baby skin-to-skin with the mum after birth. It is a completely life-saving strategy. We don't need any electricity, we don't need any fancy equipment that's going to break. You just need a mum and a baby.
The Barhirdar Health Centre trains midwives from the Ethiopian midwife schools and supports the 9 surrounding health centres with training and referral support. The Barhirdar Health Centre was voted the best place to deliver in the region in 2016.
We've been delivering over 2,000 women there per year, and there's been no maternal deaths and no fistulas in the last 3 years coming out of that hospital.
Recently it was voted the best place to have a baby. And the reason it's excellent, it's not because of the tin shed, it's because of the midwives.